As you approach those final weeks of pregnancy, you may have tons of questions circling your mind, especially if it's your first time giving birth. This video is part 1 of the first stage of labor. I'm Annabelle Carney, and if you're new to my channel, thank you so much for stopping by, and don't forget to hit that subscribe button and ding that little bell down below. For months now, your body has been working so hard to prepare for your baby's birthday, and now it's nearly time. And as the end of pregnancy draws near, you might begin to notice some signs that your body is preparing for the big day. So, for instance, you may lose your mucus plug, which is that thick gelatinous substance that seals and protects the cervix, preventing any bacteria from entering the uterus. And sometimes it can be accompanied by a small amount of light-colored blood, referred to as a bloody show. And this is because your cervix is dilating and those blood vessels are breaking. So it's just leaving behind little bits and pieces of blood in your mucus. Also, might experience a sensation of lightening, and this is when your baby drops lower into your pelvis, relieving any pressure on your diaphragm, allowing you to breathe more easily. And while this shift can provide some relief from that shortness of breath that you've been experiencing, it might also exert a little bit more pressure on your bladder, potentially causing you to pee more often. Additionally, you might experience some increased discomfort in your pelvic area as baby's head engages in preparation for childbirth. Another sign that labor is near is encountering sporadic Braxton Hicks contractions that increase in frequency. And lastly, you might experience diarrhea, vomiting, or indigestion, and this is because there's this rapid shift in hormones, and just think of it as your body's way of naturally cleaning out and prepping for baby's big arrival. Now, there are 3 stages of labor, and the first stage is the longest as it begins with the onset of regular contractions and ends with full dilation of the cervix. Now, according to the Office on Women's Health, the first stage of labor is usually 12 to 18 hours long, but it really can vary considerably if you've previously given birth. Also, most labors begin quietly, then progressively build, without a defined starting point. And very few labors actually begin with spontaneous water breaking like you see in the movies. Now, I say regular contractions because there's something called prodromal labor, and that's when you experience early labor symptoms, but they don't advance or become consistent. So for instance, you might have contractions, but they remain spaced out and they don't increase in intensity. So you may have contractions that are 5 minutes apart and then not have one for another 30 minutes. Then a few minutes later, they come on again. But looking at it as a whole, they lack consistency. You can also still communicate very easily during these contractions, and there is no progression. Unfortunately, prodromal labor can persist for several days and even a couple of weeks. But this is also a great time to start practicing breathing techniques or using comfort measures if any discomfort becomes too intense. Now, the first stage of labor has 3 phases: early, active, and transition. So early labor is when you're dilating from 0 to 6 centimeters. And when you first begin to dilate, contractions are more so just noticeable and kind of crampy, but you can still talk and they don't interfere with any activities that you're doing. Also, your cervix needs to become very thin and soft, known as effacement, in order for dilation to progress. And for first-time mamas, the cervix must efface considerably before it can begin dilating. This is the perfect time to just ignore it. So as you begin to dilate even further, your contractions may make you stop whatever you're doing, and you may think, oh my goodness, that was a lot more intense. And at this time, it's a good idea for you to eat some nourishing food and energizing food, practice deep breathing techniques as you move through each contraction, and also you'll want to make sure that you don't overexert yourself because you want to conserve your energy for the rest of labor. This is also the perfect time to notify your care provider and all the people on your birth team. Also, if you have kids or fur babies, notify any family if you need a sitter. And lastly, your goal is to spend as much of early labor at home that you can manage to avoid showing up to the facility too soon. Now, although early labor can take a long time, remember that changes are happening within your body and just try not to overthink things. So get ready and be excited because you are going to meet your baby very soon. I hope this video helped you get a good understanding of what some pre-labor signs are and what early labor might look like and what you could be doing during this time. Thank you so much for watching, and I'll see you in part 2.